My name is Vicki Evans. A local nonprofit made up of healthcare companies provides support and education to many area nonprofits. We're going to learn more as we welcome Sharon Rothman. Sharon, thank you so much for being here.
Thanks for having me.
And Sharon is the president of Health and Wellness Marketing Group. And then we also welcome Tiffany Taylor. Thank you for being here.
Thank you.
And Tiffany works for Carestone Assisted Living. So Sharon, talk about why really basically for-profit healthcare companies in our area wanted to form this nonprofit.
Well, we really saw a need for it. As you said, we are for-profit, so we all represent different areas in the senior aging industry. I myself work for a company called MedTech Tools for Mature Living, who does durable medical equipment. So they're all for-profit, but we really saw a need in the community to get together and try to help out some of the area agencies that specifically help seniors.
Okay, and what are some of those? Let's talk. You work quite closely, Tiffany, with seniors.
Yes.
You're working in assisted living. Let's talk about some of the issues that seniors are facing and the growing number of our senior population in the United States.
Okay, well, I work for an assisted living, so I see a lot of issues that come through the door. Seniors that have lived in their home for so long and now need to find a place where people can watch them and help take care of them. And it's very difficult for them to make that huge transition.
What are some of the problems they face when they're making that transition? What are things that have to be considered?
Some of the things are not being able to drive their car anymore. They have to give up the keys and rely on somebody else to get them to where they need to go. Their appointments, their shopping. Some other things are dementia. We see so many that just can't remember to take their meds or to
Some people just can't even remember to turn the stove off. They've
Yes.
turned the stove on for a meal and can't remember that. So it's really key that they find a safe environment for them. That's really what we're all in this about. It's the safety of the seniors.
Definitely.
Whether it's a hospice or a home health, it's just getting a good placement for them that's safe for them.
exactly.
Right. And what does, what our aging population, we're living longer, but and I know you're not doctors, but talk about some of the actual medical problems that a longer age, that perhaps we deal with now more in the modern society than our parents did with our grandparents.
Absolutely. Well, as you said, the longevity is there. So you've got people living well into their late 80s, early 90s. And unfortunately, you've got two situations. Either their body is going to fail them and their mind is still cognitive, or their cognition is going to fail them and their body is fine. So you've got that dilemma. It's where do we place them? Are their needs going to be the best met?
Okay. And talk a little about Tucson as really a retirement mecca. So we have, for example, Pima Council on Aging, and I can't think off the top of my head of other nonprofits that deal with our growing senior population. So talk about the relationship between Health and Wellness Marketing Group, the growing, our senior population here, and then the work with the nonprofits.
Well, we established, as I said, we are for-profit, but the company, or our Health and Wellness Group is a 501c6, so we are a nonprofit. So 2 years ago, we decided rather than having a conference that would make money every year, we'd like to give back to the community. So we started doing a benefit for an area a nonprofit agency in Tucson that specifically helps seniors. And our first one was Pima Council on Aging, and Tiffany
Yes.
can really talk about that. She was on the board for that.
Were you? So,
Yes. In 2006, we raised money for Pima Council on Aging, and then in 2008, we raised money for Interfaith Community Services. And for both of those, the Health and Wellness bought out the Gaslight Theater, and then we sold tickets. And in 2006, we raised close to $3,000 for Pima Council on Aging, and in 2008, we raised close to $1,500 for the Interfaith Community Services.
Right. Right. And do you also find that, do you think, I guess what I'm trying to say is, can you, anybody give us kind of a ballpark feel of, you know, the increasing number of seniors that are in this area? I mean, our area, let's say, as opposed to Davenport, Iowa.
Oh, absolutely. You know, because we're such a Sun Belt area, you know, like Florida, we have so many assisted livings and home health and hospice because of the abundance of seniors that we have. I unfortunately don't have numbers
Right.
of that, but you know, we see it every day. You've probably, well, I know for a fact we have 19 skilled nursings in Tucson. Now that's quite a bit to support, you know.
Say that to me again.
We have 19 skilled nursing facilities in the Tucson area.
So a skilled nursing facility equals?
A skilled nursing facility is one of two things. It could either be for a long-term care. It's where people can no longer live home but can't benefit from an assisted living. They really are a higher level of care.
Okay.
Perhaps they're a two-person transfer. Perhaps their dementia is so bad that they're harm to themselves or to others. The other component for a skilled nursing is the rehab side of it. Say for argument's sake, you know, God forbid you hurt your, fractured your hip. You would need to go into a rehab for a couple of weeks to get that physical therapy to get back to where you were before. Right. So just by the mere numbers, you look at 19 skilled nursings in a town of, 1 million plus people, that's a lot.
Is it? Yeah. Which really underlies the point of our being a great place for retirees.
Exactly. People come here as snowbirds, every year, and then all of a sudden, whoa, I can't really manage my home anymore, but I really liked Tucson as being a snowbird, so I think I'll just, come out and stay. And again, that's why assisted livings are there. That's why we have the, the home health, the hospice, things like that. Right.
Mm-hmm. So the Health and Wellness, the nonprofit that you all are a part of, tell us about some of the meetings and what people that, because you have nonprofits as members of your organization, right?
Correct.
And so talk about what perhaps a newcomer who might be interested, what kind of meetings and what you talk about. And
well, our meetings, they're typically breakfast meetings. They start at 7:30 in the morning and go to 9:30. And typically we begin with networking. So we all kind of walk around and see who's there and talk about who we represent and what's going on. Then Sharon, our president, gets up and reads the mission statement. And then we all have the chance to stand up and very quickly say who we are and who we represent. The next thing we do is we have a spotlight. We spotlight our corporate sponsors, and they're allowed to talk for maybe 3 minutes. And then we have a speaker who gives some kind of educational to us. It's different every month. And then we adjourn with anything anyone needs to announce.
Right. All right, so we are talking Health and Wellness, the Health and Wellness Group. And Tiffany was just describing a meeting, a lot of networking and education. So if you're interested in the Health and Wealth Marketing Group, the monthly meeting is at the Viscount, we say Viscount here?
Yes.
Yes, okay. Viscount Suite Hotel, and that is at 4855 East Broadway. And 7:30, as Tiffany mentioned, to 9:30 a.m. Again, Viscount Suite Hotel on Broadway. And to find out more, to learn more, you can contact Health and Wellness in 2 ways. 907-8165, that's 907-8165. Or, obviously, the website, healthandwellnessaz.com. That's healthandwellnessaz.com. Do you, you would think people in an industry, network on their own, because you're all up on what the, what kind of keynote speakers and so on do you bring in, or just talk about some recent ones?
Well, we really try to adhere to our mission statement, which is to educate the group on current healthcare issues. So we have people like Adina Bank-Lees, who's a psychotherapist with Sierra Tucson, and she does sexual addictions, which you'd think, wow, how does that kind of tie in? But she actually had a great meeting. We had her for last month, and she talked about how to talk to seniors, how to understand them, how to get them to hear you. And she did we did an interactive portion where we had a little play. It was just great. But we do have other people. We've had David Fitzsimmons from the Arizona Daily Star, the political cartoonist. He's come really just sort of as humor, because if you can imagine being in healthcare, it's great, but there are days where you're down. You've got people that you've really grown close to that pass. So it really, that's why we looked at starting this group, is because we all really support each other. And after a while, we realized, well, we're supporting each other. We really need to bring it out to the community and support the community. And so that's, again, why we established these two benefits. The one that we just started in 2006, and we will continue. But the other thing that we do is we establish scholarships. We did one at the University of Arizona in the marketing department, and we established one at Pima Community College in the nursing department. And each year at our holiday luncheon in December, we give money towards that. Excuse me, we give money towards that for the scholarships, and we always get a great letter from whoever has benefited from that scholarship. So we really want to bring back to the community, and that was really kind of our purpose here today, is to let people know what's out there, because we're a little known group, sort of a diamond in the rough, if you will.
Right, because I asked, before we went on the air, I asked her, and I said, well, how long have you been here? I was thinking new, but you said 1992.
Correct. We were initially an offshoot of the Chamber of Commerce. It was a subcommittee called the Health and Wellness Committee, and that went for a while, and then we sort of moved to the Northwest Chamber of Commerce. We kind of got, moved around, and then we looked at each other and said, you know what, let's just start our own. And we did, and it was a very small group initially. We had maybe 15 people in attendance, and we used to meet at the Pima County Medical Society on Farnes by TMC.
Right.
And it was great, and it was really small, and then it just sort of blossomed, and we now, as you said, we meet at the Viscount. We generally have about 80 to 90 people a meeting.
Wow, wow. You mentioned, I want to ask Tiffany this, you mentioned scholarships. You have a scholarship fund that you give, what, one or two each year?
Correct.
So talk about, if you can, jobs or hiring or careers in really to the health and wellness industry, but specifically with seniors. I don't know, I may just be buying into a terrible misconception that care for seniors can be, is there a career in that? That's what I'm asking. So if you could let people know, what's available, what.
So the different careers.
Yeah.
Yes. Well, there's many. Well, we do a lot with marketing groups. So there's assisted living, independent living, home health agencies, hospice agencies, medical supply, just many different ones. Fiduciaries that help.
Tell me, what is a fiduciary? I should know this. It's a word I hear, but I nod my head, and I'm going to ask finally.
A fiduciary is somebody who actually, as a senior, if you are not capable of making decisions financially, they're like a trust officer, but there's a different regulations for them. They're regulated.
It's kind of like a power of attorney in a way.
Exactly. And most often we find case managers that have gone into private case management companies are also private fiduciaries.
All right. So there really are a lot of careers then.
Mm-hmm. There's a lot.
Because one thing I'm reading in this economic downturn that we're all spinning around in is that, the health industry is one that's still employing.
It is, and I think it will, solid as solid can be. Let's, I'll knock on wood and say we all have a job. But, we're all going to age, so we're all going to need care at some point. And whether it's going to be, a small caregiver at a small adult care home, or perhaps an administrator in a big assisted living, there's a lot of things in the healthcare industry. Personally, I work for a medical supply company. People are always going to need walkers and wheelchairs and things that we supply. So the healthcare industry is pretty solid. we oftentimes get a bad rap, the healthcare industry, because they think, you know, the insurance are just big conglomerates. And again, I think that's why we kind of developed the health and wellness, is to see there's real people behind it that really care and have a passion for seniors, in particular in this industry.
Right. How long have you, Tiffany, been working in the industry?
For close to 8 years. It'll be 8 years in May.
So you started when you were 7, right?
Exactly.
One of the first ever in Arizona, right?
Exactly. Very gifted child. Absolutely.
So for 8 years, though.
Yes, yes. And I actually started, I was pregnant with my second child and started working at the front desk in Carestone Assisted Living, and fell in love with the seniors and knew that this was something that I wanted to do. So got some training and.
Right. Let's talk about training. It's not. What kind of training do you need that's perhaps minimal to begin to look for work, and then I suppose it could expand, you know.
Well, it depends on what area you're going into. If you're going into caregiving, there are several groups in Tucson that will do caregiving training. So you would just look up, and forgive me, I'm not really savvy on that, but I'm sure if you got on the internet and Googled it, you would find it. In terms of marketing, it depends on what the company wants. I myself happen to have a bachelor's degree in communications from the University of Arizona, and that sort of got me into the public speaking arena and then doing the marketing. Tiffany, you know, went to college for a couple of years and then started raising kids, but as she said, she started as a receptionist and just worked her way up.
Right, and then you said you took a couple of training classes. That's, I guess, what I'm curious about.
The company actually put me through some training. They have different courses through the company, and one's called Ask and Ask Again, and you can take caregiving classes, so that way you know what the caregivers are doing and how they're taking care of the residents.
That's actually rather a cool concept, you know, learn on the job, and, you know, they offer courses that you can take to improve. That's actually I like that idea.
Yes, I do too. But I think most companies just sort of get a feel and a sense. Seniors can be difficult to work with, and we all have mothers, so we all understand that. And I think it takes a really compassionate, understanding person to do that. So hopefully we fit that bill.
Yeah, it is. It's a hard, you know, anything in the health.
It is.
My hat is always off to people who work, you know, providing health and care and warmth and love and all those good things to, you know, to people in need. So, what about what are some long-term goals then for the health and wellness group?
Well, we want to, as I said before, we want to continue doing our benefit for nonprofits. And this year in May, we're actually doing a conference. It's called Unlocking the Secrets to Healthcare Marketing. But next year we will be doing our nonprofit benefit, and we started to get ready for that. We submit an RFP. We get a list of the nonprofits in Tucson that specifically work with seniors. There's a list of about 50. We send the RFP, which is a request for proposal, out to them. They fill out the information, send it back to us, and then we actually get 3 people that are not associated with healthcare to go through these RFPs to pick, and they number it, and we add up the total, and whoever has the highest number out of these is the one that we select as a target. We've done Gaslight Theater, as Tiffany mentioned, for the past 2 years. We're looking at something different for next year for 2010, but we're not sure yet.
Okay. And again, we are talking to Sharon and Tiffany, and they both have day jobs, but they also are a part of the nonprofit group Health and Wellness Marketing. And so we'd like to make sure you have this information. Monthly meetings, the Viscount, look at me, I swear, Viscount Suite Hotel, and it is 4855 East Broadway. And the meetings are monthly, 7:30 a.m. to 9:30 a.m. And you can find out more about the meetings and about the organization by contacting 907-8165. That's 907-8165. And the website is healthandwellnessaz.com. That's healthandwellnessaz.com. You know, I'd like your professional acumen here to answer this, and since you're both in working with seniors and in the industry and see trends, what do you think are going to be some good things in the next few years coming out for senior care, and maybe some challenges that we will all have to face? I'm going to ask both of you.
Well, I think the good things that are coming out is as technology increases, they're always finding new ways to reinvent the wheel. And let's just take, for example, a walker. 30 years ago, it was just a stick that had a couple of wheels on it. They now come out with these fancy walkers where they have seats and brakes, and it's much safer for the seniors. Not only does it look good, yes, a little more expensive, but it really is a safety issue. So I think as technology increases, we're going to find better technology because we're aging and lasting longer.
Right, and that maybe was as regarded a field of invention. Technology for seniors. We seem sometimes to dwell on different areas of our population.
Correct.
And now, surprise, huh?
Yes.
So,
You'd be surprised how many of the big assisted living centers and retirement communities have computer rooms for the seniors, because they're becoming very computer savvy with email. They're Skyping, they're webcamming to see that their grandkids in New York
That's
that they
great.
couldn't see before. So it's wonderful.
Right.
So I think that's great that they are opening up their minds a little bit more to encompass the ever-changing world.
right. And how about you, Tiffany?
Well, there is one thing that we've been talking about that could happen. We're not sure, but we talked about the skilled nursing facilities. And then a step up from that is the assisted living. There's talk that in the future there will be no more skilled nursing facilities and it will be assisted living only, which is a nice thought because many people think, I don't want to go to skilled nursing. It's too clinical. It's not as warm feeling. In assisted living, it's more home-like, and that there's talk of that in the future being assisted living only. And
Changing the dynamics a little, or the terminology, perhaps.
Right.
And I think one of the downsides, and I hate to talk about negative, but unfortunately with the economy being what it is, people that had their savings that said, we're going to retire and move to Arizona, and then we'll be able to move to an assisted living or a retirement community, that money isn't there like it was, or the house couldn't sell. So some of their living arrangements have to be changed. The thoughts have to be changed. So children are starting to look at becoming caregivers and bringing mom and dad in simply because of funds being much more limited than they were 5, even 3 years ago.
Right.
Right. What about daycare for seniors? How is that a concept? I mean, I know I have again an aunt who is Alzheimer's, but she does go to daycare. Now this is Florida, and then lives with my cousin and her family. That's her home now. Is that a concept that we have here or do
There
much
is,
with?
if I can do a couple of plugs.
Sure.
And these are both nonprofits. Handmaker has a daycare setting. Again, I know that they have it. I don't know the specifics. So
Right.
if any of the viewers are interested, they could contact Handmaker. And then Streams of the Desert Church, they also have a daycare. And I don't know, again, the specifics, but you could look up both of those. So it would be Handmaker and Streams of the Desert.
All right.
I know a little bit about that. They come in the morning. Their loved ones drop them off, and then they have programs throughout the day. They do lots of activities, some outings. I know they go to the zoo and different things. And then they go home in the evening. So it's just like a daycare, but with lots of activity and nursing and
Right.
people to help them out
And
through
for
the day.
adults.
Exactly.
Yes, exactly.
Right. Do you think, having been in the industry for a while, Sharon, do you think our concept of our elderly has changed as a society? I'm thinking of the many Asian societies where the elderly are venerated, where they are, really placed on a pedestal just because of their experience in life, life expansion, lifetime on this earth. Do you think we are learning to do that more with our seniors instead of discard or hide away?
I do think so. I think we have a long road to go, though. I do think that seniors don't have the same respect that, or have not the same respect, but have the respect that they are due. I know Tiffany and I have talked about this often. They've got stories that are amazing. I used to work for an emergency alert system, and so I would go to their home and install it, and I would be there for hours listening to their stories
Right.
because they just have so much to teach. So I think if we continue like health and wellness, that's what we do. If we show our children and our grandchildren the respect and have them, I think the best thing is to have them be around seniors. Then you're not so scared. I think people are scared of the unknown. I also think sometimes it's a reality check for people. Oh, that could be me in 30 years.
Right, right. And we only have a couple of minutes, but it did, thank you so much. What you said just made me want to ask Tiffany a question. Does, for example, the assisted care facility you work with, do they like volunteers? I mean, could people volunteer?
Yes, they love volunteers.
What would
It's
what would volunteers be doing?
They might call bingo or just go around and visit with people. They might pass out goodies while we're having a happy hour, or there's so many things to do.
To help with events at the facility
Yes.
and mentor and be a pal, I guess.
Definitely.
And enjoy some of these great stories. That's what I was thinking.
Exactly.
And just
Exactly,
listen.
yes.
We all love people to listen to us, regardless of our age. As I say, we only have about 30 seconds. What would you like people to walk away with?
I would just want people to know that there are groups out there that are really trying to help the community, and we may not get the publicity and the press and the hoopla that other agencies do, but we really, as healthcare marketers, really want Tucson to know that we're out there for them.
All right. And Tiffany, how about you? 30 seconds. I know it. I always put people on the spot.
Well, the same thing, just that we're out there to help, and our goal is to make seniors' lives better and more fulfillment. So.
And on those words, thank you, Sharon, Tiffany. And remember, we'll all be seniors one of these days, and we're all a part of a rich fabric. And when we help each other, that fabric becomes richer. Thank you both so much.
Thank you so much.
It was great.